Do you know your family health history? Well, there's no better time to start asking those important questions than when you're gathered around the table for Thanksgiving dinner. The doctor is in the house with what you need to ask before your next doctor's visit. We'll do that coming up on Good Morning Arizona.
Welcome back, everyone. Do you know your family's health history? Are you or your family at risk for things like diabetes, cancer, and other life-threatening conditions? The Surgeon General has declared Thanksgiving as Family Health History Day. So it's really simple. While you're with your family for Thanksgiving, talk about your health. Get those questions answered. Dr. Sharon Thompson with Central Phoenix OBGYN joining us right now to talk a little bit about National Family History Day. Yeah. That is perfect for Thanksgiving. You're already going to all be together.
Absolutely, and I think that the Surgeon General was wise in taking advantage of this opportunity when families get together. So instead of arguing about politics this year, let's talk about something that can be beneficial for the entire family.
Perfect.
So much of our health is based on the history and the exam. So history is a key piece of making a diagnosis.
What can a family history help a person with if you know your mother's background, your father's, your grandparents?
Sure. So there are some preventative things that you want to think about. If you know that diabetes runs in your family, you want to think more about your diet, about your exercise, about watching your weight. Certain cancers run in the family, so there's some screening tests that you will want to make sure you don't miss. So knowing your family health history can help you take proactive actions to protect your health.
All right. Using that time when you're with your family, of course, and asking those important questions. Also, when you talk about preventative measures, it's also helpful maybe if you do have something, now you know the background of where it's coming from and what to do next and what's worked or what didn't.
Absolutely. Some diseases, for example, breast cancers. If some women in your family got breast cancer at an early age, you want to start being vigilant even earlier than the recommended screening for the general population. Dementia. We can diagnose dementia very early before, memory and those sorts of things kick in, and there may be some things that we can do to help slow the progression. So it's so important to know, is that in my family? Am I at risk for that?
And aside from just talking about it, it's important to probably have some kind of file system where you have this all logged.
Yes. So a couple of things. One is your family health history, and the second piece is advanced directives. So for those older members of your family or anyone with a chronic disease, what would they want if they couldn't make their own decisions? How do they want you to care for them if they can't care for themselves? These are important questions for all of us, actually, because any of us can wind up in a situation where we can't make health decisions, but especially important for our family members who are older or who have chronic health conditions.
We talk about family members who are older. Also important to ask the right questions, I guess, when you are with your family, not just amongst who's there at the table, but even those who maybe have had issues who have passed away?
Yes, absolutely. So many times, when we're trying to find out family history, someone will say, well, grandma had cancer. I'm not sure what kind. Did she die from it? Did she die from something else? So it's so important, even though some of these questions are challenging, to find out those details about what was the disease, what was the treatment, did it work? Did grandma die of the disease, or did she die of something else unrelated? Because those things are so important for helping you make decisions as you move forward.
And the questions that we have on the screen are so great because things you maybe not have thought of, down to how old was a family member when they passed away. The age makes a difference.
Absolutely. And then the other question that can sometimes be sensitive and secret in families is anyone adopted? Oftentimes these things come up later on in life, and it makes sense. Parents might not tell a small child that they're adopted, but when you become an adult, it becomes important information to know. So Thanksgiving might be the right time to talk about your family health.
All right, so there you go, guys. That's the directive that you have to do now on Thursday, aside from enjoy Thanksgiving. Yes, leave the politics out. Talk about health, make everybody healthier and smarter in that sense. Thank you so much, Dr. Thompson.
Thank you for having me. This is an important topic. We should all talk about it.
Absolutely.